we explore the world of lupus and autoimmune conditions. And we will be joined by experts in studio and, of course, those living with some of these conditions. Now, if getting the COVID-19 virus is not scary enough, well, having your immune system fight itself puts you in a more concerning position. Just like children and the older people, those with underlying conditions are more susceptible to getting this virus. Well, here are a few people with various autoimmune illnesses.
Developed a butterfly rash, so my face will be a little bit purple, whitish. So it was a very weird amigo color thing.
No, for me, I didn't get the rash, and the disease progressed and ended up attacking my kidneys. I hated hospitals. I didn't want to go. I'd try and prolong going for the visits, and this only made my condition worse.
My lupus, her lupus, the lupus is very different. The lupus in black skin versus the lupus in the white skin, the black skin is more aggressive.
My eyelids were drooping. That is the first sign of myasthenia gravis. So after a few tests, he told me that he thinks I have myasthenia gravis. So he referred me to a neurologist at Aga Khan. My body started failing in 2015, but I didn't know that it was failing. So if I'm standing and they decide they won't do anything, my limbs, I will remain standing until when they gain motion. If it's walking and they decide that there's nothing being done, I'll find myself down. And my boss was quite concerned, and he sent me to Kenyatta National Hospital. After a series of tests, they re-diagnosed me again with myasthenia gravis.
It's predominantly caused by your body generating abnormal antibodies against its own tissues, what we call autoimmune conditions.
If I try to crouch, I'm unable to lift myself up.
Multiple sclerosis can mimic a few of other neurological conditions.
At 16, I was being taught how to walk again.
Those are testimonies of some of the patients who live with autoimmune conditions, and of course we are joined by some of them. And I will start off with Lucy Namirimu, who is living with lupus and joins us all the way from Uganda virtually. We are also joined by Eugene Genga, who is living with lupus and is also the founder of Kenya Kidney and Lupus Foundation. In studio, I've got Dr. Eugene Genga, who is a rheumatologist. Thank you for your time. And in our other studio, we have Dr. Angela Migoa, who is a pediatric rheumatologist and also an assistant professor at the Aga Khan University Hospital. Thank you all for joining me to have this very vital conversation. Now, Dr. we'll start off with you, Dr. Genga. What are autoimmune conditions? Let's start from the basics.
The basics. So the basics, we'll first start with the immune system. So the immune system is it's like the body's defense mechanism that protects you from infections such as germs, bacteria, and everything. So when you have an autoimmune disease, there's a defect, or there's a problem in the immune system, such that the immune system cannot recognize between germs and your normal self. So it attacks everything. So if it attacks the joints, it can present as like rheumatoid arthritis. If it attacks the tissues, it can present as something called lupus. If it attacks the muscles, it can cause myositis. If it attacks your diabetic cells, the pancreas, it can cause type 1 diabetes. Yes.
So you're talking about the immune system attacking your body. What causes that?
To be honest, we are still trying to understand what exactly causes. There are a couple of theories that have been proposed. One, we think there could be an element of genetics because certain diseases have been found in families. Take, for example, like lupus and rheumatoid arthritis. Secondly, things like westernization from the cigarette smoking. There's a certain chemical in the cigarette called hydrazine that has been found to trigger lupus, so smoking has its own risks. Other causes of autoimmune conditions include things like obesity, lifestyle changes, which right now are adapting more of the Western lifestyle. We've also found an association with certain diseases. Take, for example, like HIV has been found to have some association with the some of the autoimmune conditions, amongst other viral infections. Yes.
And would you classify autoimmune conditions as rare conditions?
There are, I don't know, I don't use rare because we're trying to raise awareness.
Yes.
It's just that I think we don't look for them. I think it's a neglected field. I mean, if you take, for example, like in Africa, the emphasis is more of infections because that is what most commonly seen. And then secondly, we don't report a lot on it because even if you try and Google some of these diseases in Africa, people usually think they're not there. Like I remember the time I presented a paper on lupus at a conference outside, and they were surprised that lupus actually is in Africa. And I think that's part of the reason because we're trying to really raise awareness about these autoimmune conditions. But they're there.
Okay.
Yeah.
So if they are rarely talked about, do we have statistics to show maybe how many patients are living with these conditions?
To be honest, data is scarce. It's scarce, to be honest. We don't really have exact data, especially in the setting of Africa. Outside the world, we have, take for example, like rheumatoid arthritis, it's about 1 to 4% in the Western world. Locally, we don't have any. We just have small studies maybe done in the hospital setup, where you come maybe in the clinic and say the following patients have rheumatoid arthritis and we try and describe them, or lupus patients, we try and describe them. But exactly the number, we do not know. And partly is because I think apart from awareness, I think also clinicians don't really look for it because for a long time you'd assume that this is a disease of the Western world. And also sometimes how they present can be confusing because take for example something like lupus, it presents as fever and weight loss and joint pain. To an untrained eye, that could be so many things. Typhoid, could be malaria, it could even be HIV. So I think our clinicians don't have a high index of suspicion of certain diseases, but over time things are improving, and we're hoping that now with the increased number of rheumatologists, we're able now to increase the awareness about the disease, and also platforms like this also raise awareness about these diseases.
Okay, and trying to understand autoimmune conditions, Dr. Migor, are autoimmune conditions more prevalent in women or men, or it really doesn't matter?
You and your team for creating this platform to create awareness for autoimmune diseases. What we do know is that because of the hormonal differences between men and women, that the women or the female gender are more predisposed to get autoimmune diseases. And this is purely because the hormones found among women increases like the identifiers on the surfaces of our different building blocks, which we call cells. And that makes it easier for your innate or inherent defense system, what we call the immune system, makes it easier for it to attack yourselves. And that's why autoimmune diseases are more prevalent in women or in the female gender.
Okay, now a condition like arthritis is mostly known to be an old man's disease, but going by your specialty, a pediatric rheumatologist, clearly this is not the case, right?
Absolutely. And for very long, that has been a huge misperception, and it still is, and is one of the challenges that we face. What we know is that for every 1,000 children, about 1 to 3 of them would have arthritis. And given our population of about 24 million, then you can imagine the significant number of children that have arthritis. So, people should always remember that children are susceptible, and especially we call them the ultra vulnerable group. And by the virtue of the fact that they are not able to verbalize their symptoms as much, they don't have purchasing power, more often than not, they go unnoticed and suffer in silence.
Okay. All right. Now, let me bring in those that are actually walking in these shoes. Let's bring in Lucy Namirimu from Uganda. You are living with lupus. When were you diagnosed?
Thank you. I was diagnosed with lupus in around 2016. at the beginning of the year.
And they say the symptoms of lupus can be very confusing to the normal eye. What exactly were the symptoms you had?
At the beginning, I first started experiencing swelling of the body, like you have an allergy and the body will swell. That is around before 2016, that is 2015, that I would go to the doctors and they would give me medicine for allergy. So we didn't know what was happening until when I went to one of the doctors, because we were not well convinced which doctor would handle my situation. So they sent me to a hematologist. He's the one who sent my lab tests to one of the lab tests around Uganda, and that's when they realized that I have lupus around 2016 at the beginning of the year.
Okay, now, Jane Banda, you have been living with lupus for over 20 years now. How did this journey begin for you?
For the other lupus warriors, I had swellings in the body, joint pains. I would lose appetite, and fatigue was very key. I was extremely fatigued. Even in the morning after waking up, I would walk to the kitchen and feel so tired. It would force me to go back and sit, then rest for a while. As the day progressed, then the symptoms would get better, and by 10 a.m., you'd not believe it's the same person again, because I would then be energetic.
Okay, and seeing that this is 20 years ago, how long did it take for you to get a diagnosis?
Oh my goodness, it took quite some time. In fact, by the time they realized I had lupus, it had actually attacked my kidneys and I was on dialysis.
Oh, wow. Okay, and they say one of the distinct features of lupus is the butterfly rash. Did you ever get that?
No, I did not get the rash. I didn't get any rashes.
All right. Now back to Dr. Genga in studio. Some of the symptoms clearly are very similar in some of the patients, but do the symptoms always look alike in everybody?
I think the best answer would be there's no two lupuses that are the same. Because if you see the Ugandan ladies, how was more of the allergic side. If you look at Jean, it was more of kidney. And as you can see, part of the challenges is time to diagnosis. And actually, we have been research in Kenya, where majority of the patients' diagnosis mean time is about 3 years, and people can be as long as 13 years. Yes, and now the thing is, in terms of the presentation, like I said, it's very confusing because the immune system is found in all parts of the body. So I'll take you, for example, some of the cases which are found. One, a patient just came with low blood, we call anemia. After the tests were done, we found out that she had lupus. Two, we found a lady who had water in her lungs, we call that a pleural effusion. After a lot of tests, we found out that it was lupus. Three, a very unfortunate lady who had lost 6 pregnancies, which is very unfortunate. And by the time we were diagnosing her with lupus, she was actually more of a breakdown. It was more of counseling that finally we had a reason why she was losing her pregnancies. And as you can see, like if you look at the chronology of all these patients, in fact, most of them were brought in at the end because people don't think about it in the beginning. And like I said, the manifestation can be anything. I've even seen a case where there's a lady who had come with psychosis. And actually, it's just that when the doctors looked at her blood picture, they noted that she had this low blood that had been very persistent. And then when they did the test, it came back positive, then they called us on board.
Okay.
So the manifestations can be very, very different.
Okay. Now, Dr. Goa, I mentioned the facial rash that's very distinct in the patients that are living with lupus. Is it something that is so obvious in all the patients, but clearly Jean says she did not have it?
You know, Gladys, I often tell my trainee doctors that, you know, the eye only sees what the mind knows. And, you know, there's a common saying that lupus has 1,000 faces. You know, that means it can have a vast myriad of symptoms. So the rash that you see in lupus, what is classically known is the butterfly rash that goes over the nasal bridge and over your cheek. That's classic. But the truth is there are so many other rashes which often are confused for an allergic rash. Sometimes you could have a red spotted rash, which someone would think it's because of an insect bite. Other times you go out to the sun and the areas exposed to the sun all of a sudden develop a rash. Again, that's a lupus rash. Other people get a rash that always leaves a permanent scar. That's another type of a lupus rash. So what I often tell people is, if you have a rash and it's not responding to conventional therapy, it will be good to connect with a skin expert, a dermatologist, and a rheumatologist to help rule out some of the autoimmune diseases within our domain.
Okay, now Lucy in Uganda, we're talking about the facial rash. Did you ever get it at some point?
I got it after a long time when the medications they were prescribing to me were not working out, so the lupus was getting to the advanced stage. So at the time when I was really in the advanced stage and I was critically ill, the rash came around, and though it was not that hectic, but at least it came around and it really disorganized my whole team. Especially the face.
Okay, and you say at some point you were critical. What was going on?
And when I was there, I was diagnosed with lupus at around 2016, early 2016. I think I failed to get the right doctor to treat that disease. So I was seeing a hematologist by that time, because maybe I failed to access the right doctor. So I had to go to hospitals, different doctors, different remedies, and the disease was getting to the advanced stage. And so by that time, around August, I was bedridden. I was off and on in hospitals. I was always admitted. I had grown thin, I had lost appetite, I had wounds in my mouth. I was always fatigued. I had so many diseases in my body. I had a lot of infections. That was my biggest problem. I was on and off UTI, infections, all different types of infections. Anything would attack me. I had typhoid. So by the time I got critical in around October, that is when the rash came about. And I think when I was working in my workplace, they were so concerned on what was happening, and they were trying to find a solution to how they can really get rid of this sickness. That is one way to refer me to the hospital in Kenya, where I was being treated. I was rushed in through the airplane. Though they failed to get an emergency exit, but at least I was rushed to Aga Khan Hospital for immediate treatment. That is when I was critical.
Okay, now Jane, you said by the time you were getting a diagnosis, you were already on dialysis. How bad has it ever gotten for you?
Well, the fatigue was the worst, because it rendered me unable to carry out my daily duties. And that also meant that I had to rely on people to get the usual things done. And at times that can be very frustrating, because you're used to doing your own things, leaving the house when you want to. And now it put me in a situation where I always have to see who's going to be free. Are they able to take me where I want to go, stay along with me until I get back home? And, you know, relying on people is not that easy. So that really frustrated me. Once they got the medicine, for me, it wasn't that bad, except for the occasional joint pains when the weather changes. And that fatigue is really something that I'm still dealing with today. Then the sun. Anytime I'm out in the sun, I kind of like feel so tired. So I really have to avoid the sun. And as I said, for me, it doesn't affect my skin at all. Even if I'm in the sun in a hot place, I hear people complain they'll get rashes, they'll get, the skin will kind of like chip, but mine does not, although the fatigue will definitely creep in. So that has been a major challenge for me.
Okay, Dr. Genga, you would think the sunshine is the best thing that ever happened to anyone this side of the Sahara, but clearly not so for the lupus patients.
That's because sunshine has something called UV light, ultraviolet light, and actually it's one of the triggers for lupus. There's a way it goes to the body, it breaks down the cells and activates the lupus. So we try as much as possible to advise our patients to avoid direct sunlight. So we encourage them either to have like a big hat, they can get one, maybe sunscreen, but as much as possible to avoid direct sunlight.
And what are the other risk factors, triggers as you call them, things that will make you have a lupus attack?
So lupus attack, apart from the UV light, infections. So we really have to do a lot of education to our patients and tell them as soon as you get an infection, you have to inform us as soon as possible, because the infection will activate the immune system, and the lupus is an exaggerated immune response. So as soon as you get an infection, you come as quickly as possible. Things like stress has been associated with the triggering. So we try as much as possible to involve counseling, psychologists. For those who haven't reached that extreme, we encourage our patients to have more relaxation exercises and a routine. Apart from stress, cigarette smoking is a trigger. So we really discourage, or if possible, just avoid cigarette smoking altogether. Things like alcohol can also do the same, amongst others.
Okay.